Obviously, CIDP treatment landscape has evolved over the last couple of years, but let's focus specifically on this agent. Talk a little bit about the mechanism of this therapy and just in the context of the emerging CIDP treatment landscape right now.
When we think about the pathophysiology of CIDP, we always have this cartoon. And in this cartoon, there are lymphocytes, T cells, and B cells, and there are autoantibodies, and there are cytokines, and there are macrophages, and there are complement factors. And these different factors damage the nerve or its environment in different ways. And the conventional drugs that we have and that we use probably affect several of them, all in to a different extent. And now the emerging treatments, they try to be specific. So, for example, the novel FcRn inhibitors, they reduce the amount of immunoglobulin and thus also try to reduce any damaging immunoglobulins. And the novel complement inhibitors that are coming out, they block complement in different phases of the activation of the complement cascade. And Riliprubart is an inhibitor at an early phase of the classical complement cascade. This is also important to say because it leaves intact two other arms of the complement cascade, which we need to protect ourselves from pathogens. This is what we have the complement system for. So this is good that part of it still remains, and the patients still that are treated still have the ability to defend themselves to pathogens. So the complement system is blocked at an early stage, and thus the downstream events activating T cells and B cells and forming this membrane attack complex that in the end damages the myelin or the axon directly or the area of the node of Bronvier by attracting macrophages who actively destroy these structures. So this is blocked, and it seemed a very logical mechanism from the start, but having seen now in the first trial that it really works in the patients is the most important, because we had other mechanisms before. As you say, from the MS world, drugs were exported to the CIDP world, but they didn't always work.